So if we're doing a growth strength screen, we would start with a general movement. We're not going to start with that right now because we already did that in range of motion. So you're using that screen for both, and you can just observe it once. So we'll go right into the isometric strength screening of the cervical spine. So you're just going to ask the patient to maintain this position and don't let me move. Don't let me move you. Okay. So we're going to touch cervical flexion. Don't let me move you. Hold it. Hold it. Hold it. Good. And extension. Hold it, hold it, hold it. Good. Relax. Lateral side bending. Ready? Hold it. Good. And hold it. Good. And then don't let me twist you. So that's typically the, and I might have you take your glasses off just so I want to put your, okay. So then you kind of grasp the side of the occiput. Don't let me twist you. So that would be testing right cervical rotation and left cervical rotation. Good, and then relax. And you're asking, is there any pain, and you're feeling for any weakness. Okay, so that's cervical spine. And then let's go into the shoulder. So I'm gonna have you guys test one arm at a time. And typically, again, we're gonna start with the uninvolved side first, so you get a sense for what their baseline is, and then you would go to the painful or dysfunctional side. Do you have any pain or issues on your shoulders? Okay, so we'll just start with the right side, just for the sake of argument. Okay, so you're gonna position them in position of convenience. So for shoulder, that's just gonna be at 90 degrees of flexion, providing a little bit just of feedback in the scapula almost so that you can just feel what's going on in that scapular region. So we're gonna check flexion, good, extension, good, adduction, okay, a little bit of weakness, abduction, good. And then bending the elbow at 90, we test for internal rotation and external rotation. And that's a little bit weak there. So you can see how she kind of gave to the pressure there. So then I might be thinking, okay, I might examine her external rotators later. Okay, we test the other side, same thing. So monitoring at the scap, flexion, extension, adduction, abduction, and internal rotation, good, and external rotation. And again, kind of symmetrically weak there though with her external rotators, so I might not think anything too significant with that. Now we're going to move down to the elbow. So positioning at 90 degrees of flexion, checking elbow flexion, and elbow extension, good. And then I'm going to place her forearm in neutral to check supination and pronation. So I stabilize at the elbow and don't let me move you. So hold that position. Okay, good. And then hold that position. Good. That was pronation, supination. And then you can check the wrist also in a neutral position. So stabilizing the forearm. Don't let me move you. Hold it, hold it, hold it. Good. And same direction this way. Hold it. Okay. And then you can also check ulnar and radial deviation from here. So pressing down would be ulnar deviation, and then radial deviation. Don't let me move you that way. Good. And then you can also go and check, you can check each individual finger as well if indicated. So again, you'd probably only be checking fingers if a patient is coming in for a wrist or hand injury. So if you were to check for abduction, you can have the patient spread their fingers and just give them a little bit of pressure towards adduction to check the abductors. Adductors, the opposite. So you'd be pulling the fingers apart. For thumb, you can have them come into, so just hold this position here. You can check her extension and flexion, and then abduction, good, and then adduction. So you're just checking all planes of motion with them. And then if you're going to check MCP, you can just have her, have her stay in neutral, and then just say, "Don't let me move you," and "Don't let me move you." Don't let me move you.
And the finger muscles don't require as much force, so don't go too hard.
Yeah. No, see, I'm just using one finger, right? So you're applying the force that's equal to what her strength should be in the hand. Okay, so that's your whole strength screen for the entire upper extremity. And again, you might not be doing every single joint depending on the diagnosis, but for a shoulder diagnosis, I would certainly be doing the whole shoulder, as well as the elbow, and potentially the cervical spine if you suspect there's some sort of neurological involvement. So if the patient might be describing a radiating, burning, tingling kind of weakness that you suspect could be neurological, you might also be checking cervical spine for shoulder. Yep.
Is this when you're doing like